Hey everyone, thanks for watching. My name is Sarah, and as you can probably tell by the title of this video, I've been having some complications the past couple weeks, and we'll be getting to that in just a minute. But this will be my weeks 13, 14, and 15 pregnancy updates, and I will talk about everything. But first, let's start with week 13, which to me is kind of like the start of the second trimester. I was really excited to finally be out of the first and into the second trimester. I honestly thought it would be a lot easier. I've been wrong, completely wrong so far. The only thing that's been a lot easier is that I don't have any nausea like I did for part of the first trimester. But other than that, things have just been like a lot harder. The main thing being my headaches. I've had headaches almost every day starting around week 13. I wake up with a headache and I seem to get a little bit better throughout the day. But then towards the end of the evening, I'll have another headache. And then sometimes during the night, they'll be so bad that I can't even sleep. So what I've noticed is that it seems to be worse when I'm laying down or sitting for long periods of time. I don't know if it's maybe a blood circulation thing, like if I'm moving around a lot, I have better circulation, and it seems to help my headaches, which is why they get better during the day and they're worse in the evening, at night, and in the morning. I'm not sure, that's just kind of what I'm thinking, but I don't like to take painkillers very much, unless I absolutely need to, so I took Tylenol a couple times, but other than that, what seems to help is drinking caffeine. So the first thing in the morning I do is I force myself to get up, because if I just lay in bed, it just gets worse and worse, so I'll force myself to get up and almost like chug a big cup of coffee. I didn't drink much coffee at all during the first trimester, but with these headaches, I feel like that's kind of the only thing that's helping besides synthetic drugs. So I'd rather just drink caffeine. So that seems to help, and then moving around seems to help. So yeah, the headaches have been a tough one. I'm still dealing with that, but I have heard that for a lot of pregnant moms, it gets better around week 17 or 18, so I'm just really looking forward to getting to that point, and hopefully things will get better. But what do you guys think of my hair, by the way? I said in one of the last videos that I was going to dye it when I hit the second trimester, which I did with that box dye that I showed y'all. I think it was called Olea by Garnier. Yeah, I like the color. I think it came out nice. And then I got it cut a few days ago as well. I asked her to just cut off 2 inches. I feel like she cut off a lot more than that, but that's fine with me. Hair grows back, whatever. But I curled it today too, so I thought do something a little different. Anyway, that's just a side note. The best thing about being pregnant for me is that my hair grows a lot faster and it doesn't get greasy as much. So that's one big positive being pregnant, is as I like my hair a lot more. Anyway, back to my other symptoms. Sorry, this video mostly is gonna be bad symptoms, but I just wanted to throw in that one good one. So besides the headaches, I've been dealing with a lot of stuffiness, which is a typical sign or a typical symptom during pregnancy, is to be just chronically stuffed up. So I've definitely been dealing with that. I'll show you what helps. Let me go grab it real quick. So I've been using this Arm & Hammer Simply Saline solution. It's safe for day and night, instant relief for everyday congestion, and yeah, it's completely safe to use as much as you need to, because it's just saline, and right on the bottle it actually says one of the things it helps with is pregnancy congestion. So so that's kind of neat that they mention that on here, but it does help. You just spray it in your nostrils, and I do it just like a couple times throughout the night, and it helps me sleep a lot better. So I recommend this. It's completely drug-free if you're also suffering from pregnancy-related congestion, or even if you just have a cold or anything like that. I really like it. So that's what I've been using to deal with the congestion. I've also had some more bloody noses, which I mentioned in the previous video. And let's take a look back at my pregnancy journal from my first pregnancy with my son Bradley. So what are we at? Week 13. Let's see. Week 13. There's week 12, second trimester. Oh, I took a bump shot. There we go. I was 13 weeks pregnant, starting to show. Baby is the size of a peach. I think I looked about the same this time around. 14 weeks, another bump shot. We were in Hawaii. I wish I was still there. 14 weeks. That's 16 weeks. I was up in the mountains with my mom. But let me find the page where I talk about my symptoms. All right, 13 weeks. We made our announcement that we were pregnant and had an ultrasound. Still feeling great. Yeah, I didn't have any headaches my last pregnancy. Looking forward to our baby moon in Hawaii. Craving sweets and yogurt. I haven't really had too many cravings. I haven't even really been that hungry lately, but I think overall the things that I want more often than not are sweets, or like pickles and vinegar, spicy foods too, which I did not want pickles or any kind of vinegar foods at all my first pregnancy, so that's different. Let's see, week 14 was a blur. We were in Hawaii. Sometimes I still wonder if I'm pregnant, I said. I don't feel that way this time. I'm craving sweets and donuts, and my weight was 125. My weight now is about 127, so I haven't really gained anything in a few weeks now. And then week 15 in my book here, feeling pudgy, symptoms still almost none. I feel some stretching and possibly movement and a bit of round ligament pain on my right side, but overall still feeling normal. Looking forward to my week 16 appointment. Yeah, so I guess I was definitely in the honeymoon stage of pregnancy last time around, but boy has it been different this time around. I definitely feel her move a lot. Not a lot, but a few times a day, if I think about focus on it, I'll feel her move. And then in the evenings, laying down, I can sometimes feel her move too. So that's pretty exciting. I didn't really feel my son move because I had an anterior placenta, meaning it was in the front my last pregnancy, and this pregnancy my placenta is in the back, posterior, and so you feel movements a lot sooner than you would with an anterior placenta. So that's pretty exciting to feel her move. But other than that, the big thing that happened this pregnancy, I'll stop babbling on and just get to the point, is that I started feeling around week 13 or so, kind of like this, I started feeling as if my insides were kind of falling out. Have you ever, this is all going to be TMI by the way, but have you ever worn a tampon that didn't want to stay in and was kind of starting to fall out, and you could feel it in between your legs a little bit? That was kind of the feeling I started getting. And so around 2 weeks ago, I have always done cervical checks as part of my natural family planning or natural family planning birth control that I've done. There's a lot of symptom spotting and knowing your body involved in doing that kind of natural birth control. And so I've always felt where my cervix is and done daily checks, because you're kind of wanting to feel if it's high or low, soft or hard, and those are indications of whether or not you're fertile, along with a lot of other things like taking your temperature and checking your cervical fluid and stuff like that. But anyway, so I'm very familiar with where my cervix is and what it feels like, and I was in the shower doing a cervical check, and I could feel that it was really low, which had me a bit alarmed, and so I was like, that's weird. It feels a lot lower than normal, but I do know from previous doctor's appointments that my uterus overall is kind of low, and my pelvic floor had been a little bit weak from after my last delivery. So I was not that concerned, but then a few days later it started to feel worse, and so I was doing another cervical check in the shower, and my cervix is actually like protruding from my vaginal canal, which definitely had me very concerned. I, finished my shower, went downstairs, and had a bit of a breakdown to my husband because I was really nervous, and he's like, you should probably just call the doctor. And I was like, oh, I don't know. I think I'll just, do a lot of Kegels and see if I can get it to move a little bit. And so I did that for a few days, actually almost 2 weeks, and nothing was getting better. If anything, it was getting worse. So about 3 days ago, 2 or 3 days ago, I called the doctor and told them what was going on, and they wanted to see me right away. And so I went into the doctor's office that afternoon. That was Thursday afternoon. Today's Saturday. So that was Thursday afternoon. I went into the doctor's office, and they did a check. Actually, it wasn't my doctor. It was the midwife, who I'd never seen before. But she did a full exam on me, and she's like, I think you're not only feeling your cervix, but your bladder is also protruding, or the medical term is prolapsed. So I have my uterus and cervix prolapsed, and my bladder all kind of dropped really low and protruding, coming out of my vaginal canal. And so they told me to come back the very next day on Friday to see my doctor in the morning, and she would fit me with a device called a pessary. It looks kind of like, I'll try and put a picture up here, but it looks kind of like a donut, and it's like a semi-hard donut. If you've ever seen a NuvaRing, that type of birth control, it's kind of like a big NuvaRing that's a lot harder, but it gets inserted in a similar way, and it is hard enough to keep everything pushed way up there. So it'll push my uterus and my cervix back up there. It'll push my bladder back where it's supposed to be, and it's a temporary fix for now. It's not very common for women my age. It's actually more common in like 80-year-old women that their muscles are no longer strong enough to support anything in there, and their pelvic floor muscles just relax way too much. And so it's a lot more common in old women, but that's what I have. So they fitted me for that, which took a few hours yesterday. And I'm still in the testing period to make sure that it stays in properly for the next few days before they give me a not just temporary, but a permanent, not permanent, but kind of like a semi-permanent one that will be mine, and not just the fitting one, and that I will wear for the rest of my pregnancy. And so that's what I'm dealing with right now. This temporary fix, so far it's been about a day, seems to be working pretty well for me. I feel a lot more comfortable today than I did the past few weeks. I feel like everything is kind of pushed back up in there. And then after this pregnancy, if we are done having kids, then I will get surgery, like pelvic floor reconstructive surgery that will be an actual permanent, hopefully permanent fix to this problem, as well as going to physical therapy to try and strengthen what's left of my muscles. So what's caused this was my last delivery, is what they think. And I don't feel like I had that difficult of a delivery with my son. I mean, I pushed for maybe a half hour tops, but for whatever reason, my pelvic floor muscles are just not strong enough to hold my ever-growing uterus throughout this pregnancy. Oh, I just felt her move a little bit. That was cute. So I have been really stressed out this week about, actually the past few weeks, about this situation that I knew was just getting worse and worse, but I'm feeling a lot better today now that I have this temporary pessary device inserted, and it doesn't feel like my insides are falling out, and it's definitely gonna not be getting worse as long as the device holds up. So that was my biggest concern, was as you know, the baby keeps growing and my uterus keeps expanding, and there's just a lot more weight in there. I was worried it would just continue to get worse and worse, and so it's better to try and fix it sooner than later. So yeah, so I got to hear the baby's heartbeat at both doctor's appointments, so that was the one good bright side to everything. And the heartbeat was about 147 yesterday, and about the same the day before. 140 to 150 is what the midwife had said the day before. So it's always great to hear the heartbeat. And what is this? You got a tack? This is sharp, baby. How'd you get this?
Tap.
Yeah.
Tap. Tap.
Yeah. Can you say hi?
Hi.
Okay. Come up here. Come say hi. Here's my son.
Hi.
He got a haircut too. It's looking a little strange, but it'll grow in, right? Got a little bruisey going on. Yeah. So, alright, well, I'm gonna close out this video here pretty soon, since I need to go down and hang out with my son, play some games and whatnot. But that's what's been going on with the past 3 weeks. There you go. And I'll show you my bump real fast as well. Oh, and I forgot to mention, or maybe I did mention it, but after we're done with this pregnancy, I will have a surgery, and I'm not sure yet if what kind of delivery I'll be having. Towards the end of the pregnancy, they'll take the pessary out, and I don't know yet if I'll be attempting another vaginal delivery or if I'll have to have a C-section. That's one question I forgot to ask the doctor, but I have to go back in on Monday and on Thursday for more appointments to make sure everything is okay. And so we'll see then, or I'll ask her then. I'll ask her then about the delivery. Okay. Here's my bump. Still not much there, just a tiny bit. Oh, now Nellie's joining us too. Hi, Nellie. You go get your shoes, okay? We're gonna go outside. There it is. Here's a better shot of my bump. And this is my 15.5-week bump. So I'll see you all in the next video, and thank you so much for watching, and please subscribe if you are interested in following the rest of my pregnancy and delivery journey. So take care, everyone.